Hi, good afternoon. My name is Alicia James, and I am the president and the visionary of the PAM Project. The acronym of PAM stands for Preserve a Mom, and the sole premise of the PAM Project is to advocate and promote maternal mental wellness for mothers of color. Today, I am going to first address something that Black communities across this country and across the world are addressing. Once again, we are dealing with the racism in this country, how it impacts the Black community, in addition to the already crisis of the pandemic. So we are currently in pain, we are hurting, we are seeking justice for our Black men, for our families. And today, many are viewing how several cities across this country have expressed their frustration and outrage with the lack of regard and lack of respect for Black life. And we are going to have a conversation today with four Black women who, in their own respectful positions, are standing up for our community, who are utilizing their education, their resources, and skills to empower the community, but primarily to focus on Black mothers and how they can advocate for themselves. So I'm very blessed to have these four women have a conversation with me today, but also for you all who are able to view this conversation to take notes and how you can be empowered, to how you can better advocate for yourselves and your family during this time and beyond. We are struggling with our mental health, but we hope that this conversation will empower you to how to move forward. So I have, the luxury of introducing Denise Bold, who is the doula and the founder of Bold Doula. She has been working on the ground levels for many years, advocating and helping mothers with births. And I'm very fortunate to have her share more information about herself today and to educate the community of how doulas can play a major role in giving mothers options about how they can advocate for themselves with their pregnancies and their birthing. So let me just introduce Denise.
Yes.
Yes, hi Denise. So can you introduce yourself, and then I'm going to then introduce the other ladies. But I just wanted you to just first speak and talk about your role.
Sure. Okay, sure. My name is Denise Bowles. I am a donor certified birth doula here in New York City. Cheers. I have a master's degree as a medical social worker. I am also a CLC and a successful single mom of a 29-year-old. I have my own podcast, and I'm also a published author.
Thank you so much. So next I have two Black sisters who have the same name but pronounced differently slightly. Nikita Hall is the visionary and president of Quilt. Quilt stands for Quietly, let me just get this correct, Quietly in Loss Together. It is her business she formed from her own personal experience, but I'm going to allow her to tell you more about it and the work she's doing for mothers and their families. Oh, I'm so sorry.
That's okay. Almost 10 years ago, it'll be 10 years, August 22nd. It's August 27th. I'm thinking of my 14-year-old's birthday. Since the stillbirth of my daughter, Anaya Marie Edwards. It shook me to the core naturally, and I needed to know more and more and more and more about the female reproductive system. And once I discovered that Black women were dying at alarming rates, as well as Black infants, I needed to do something. Quilt was never meant to be an organization. It was only meant to be a one-time event, but people could not get along, so I turned it into a nonprofit, which provides support to families who suffer the loss of an infant from conception through age 2. We train people, anyone who works with the birthing demographic at any capacity, to become PAIL, pregnancy and infant loss advocates, so that they can provide services to families who suffer these losses, accurate and adequate services to these families, be it a support group, be it doula work, be it being with them physically in planning their babies or the mother of their child's services. There's more, but this is enough for now. Thank you for having me.
Thank you so much. Yes, and thank you for the work that you're doing. Nikita, can you also tell us about the work that you're doing in terms of helping mothers with their mental health? And I know you've been in practice more than 13 years, correct? But can you tell us more about the work that you're doing for mothers in New York in terms of their mental health and
Hi,
wellness?
I'm sorry, my computer's going in and out. My name is Neka Simister, and I am a psychotherapist. I've been working with families for about 13 years, but I've been working specifically with perinatal mood and anxiety disorders for the last 4 years. And, I decided to go that route because I understood in working with families that the core kind of started from motherhood. And so it was really important for me to work with women. Well, let me rewind a little bit. So perinatal mood and anxiety disorder, it's formerly known as postpartum depression. And it was important that that change happened because we started to realize that it wasn't just depression, it was anxiety and PTSD and trauma and all these things that we were affected by. And so it's really important for me to hold space as a therapist, but also really help women advocate for themselves and within the hospitals and how to get care for themselves, specifically now where there's just such an increase in death of Black women during childbirth. I'm located in New York City as well. I work both in the Bronx and Manhattan.
Thank you so much for the work that you're doing. And I wanted to say, I'm going to ruin your name, but she's coming from California, so we do appreciate you being up early your time with us. And she is the only mom that I have on the panel today who is still working on the front line as an essential worker in her advocacy for families in the correctional facilities, and really to help let them know that they are not alone. So I know you have more than 25 plus years in the work that you're doing in California and beyond, but can you tell us more about the work that you're doing and the organization I know that you're trying to formulate at the current time for families?
My name is Ayula Mitchell, and I am in the San Francisco Bay Area. I currently work, as Sister Alicia said, on the front lines. I'm an essential worker. I work in the jails in San Francisco County, and we've been working every day since the pandemic. I work to support and create programs within the jails, and one of the programs that I oversee is our family. It's called One Family, where our clients that are in custody have the ability to continue seeing their children one to one, not behind glass, every week. I also do a lot of healing work with families who have been justice system impacted, as well as families, specifically moms who have lost their children to violence. I'm the mother of 5. One of my children survived 17 gunshot wounds, which is really how I kind of went from facilitating and teaching to the healing work that I primarily do now. That was 11 years ago when I transitioned into doing a lot of healing work. And also within my job, I also do a lot of support of moms who work in carceral settings, because we are constantly bombarded with secondary trauma and sometimes firsthand trauma by what we see, hear, and experience by working in jails. I also work at San Quentin, where I also do programs there.
Well, let me just start my first
Oh, and
question with you.
the organization that I am starting is HEAL, an acronym for healing, empowerment, accountability, and love, where I will continue to do the healing work with people on both sides of the walls.
We appreciate you, and I'm so glad that you are on this discussion with us today, because people need to be reminded of the families and our loved ones who are behind bars, and that during this time that they're not forgotten.
Right.
So I'm going to start with you, because I did do a conversation last Saturday with essential workers, and so I want to know, during this current time, what is it like for you as a mother and being on the front line as an essential worker? As we're experiencing what's happening currently this week, what is it like for you? And how do you show up and advocate?
First and foremost, how I show up is taking care of myself. And this is one of the things that I was sharing with you last night, is that I learned through what I've gone through with my boys that not just self-care, but radical self-care is so important, because I have 5 children, 2 grandchildren, a daughter-in-law, and 2 elderly parents. That's just my family. And I realized that if I'm not healthy, or like I like to say, if I go down, there's a whole nation that's going to fall. And so I have to take care of myself, my mental well-being, my physical well-being. And that's really where I start. And when I'm healthy mentally, emotionally, and physically, then I have a greater capacity to show up for others and to hold space for others, particularly during these difficult and uncertain times. I was out of town. I was actually back east working when the pandemic became, when it began to come to our awareness. And coming back, I came back early, and I immediately went to work the next day, because I knew that if we weren't getting any information, then those that are in custody are getting even less information and more misinformation, fragmented information. And it's been really challenging to show up to work every day with such uncertainty, to dealing with the energy of those that are in custody, to my coworkers, as well as my family. As I shared with Alicia last night, I have a 22-year-old who was scheduled to graduate from college on May 9th, and her graduation was canceled, and it was virtual. And then I have a son who was preparing to transfer from a 2-year school to a 4-year school, and he's an athlete. So all the recruiting was done on, in phone calls and in Zoom calls. And so in addition to managing my own emotions and the uncertainties, as well as work, it was also managing my children who, college graduation is a huge thing. And she was devastated. And
Right.
though she understood why, she had busted her butt for 4 years to graduate on time. And so it's been a lot, but I have found that for me, my self-care, as I said, helps me to be healthy and to be present and to hold space for other people who may not be as mentally and emotionally healthy.
I wanted to just mention on one other thing, because you did share with me last night, as we were preparing for this discussion, that you have 3 generations under the same roof. So how is that when you come back from the working and returning home?
Well, I was actually in Southern California last weekend. My parents and 2 of my daughters live in the same home, and I was down there visiting last weekend. And it was good to be there and to be away and be able to shut down, but it's also the concern of, it was like when you're trying to play double dutch, do you jump in, do you not jump in? When do I go? When do I not go? I hadn't seen my family since Christmas. I'm able to FaceTime my daughters and my mom, but my dad is suffering from dementia. And so I wasn't able to FaceTime him, but it was good. It was good, all of us being together. But it's difficult because that decision, and there were some family members who didn't support the decision that my oldest daughter and my mom and I made for me to go down there because I'm an essential worker, because I'm in the jails. But I do want to say that in the facility that I work that has 400 men in custody, that we have not had one positive COVID testing. No one has tested positive for COVID-19, for the coronavirus, staff or people in custody. And we're doing a lot.
A blessing.
Right. And there's a lot of preventive measures from day one. California, shout out to our governor who really got ahead of it. Mayor Breed, who's a sister in San Francisco. They've really done a great job. We've only had in the whole jail system that I work in, we've had 5 people in custody test positive, and they all came into custody testing positive, and 5 staff members. And it's a, San Francisco, it's a nice size. It's big. And we've also released 400 people during COVID.
Good to know. I'm glad to hear that. So I'm going to come back to you because I also want to ask each of you and other ladies how you are, the people that you're in contact with, your population, your communities, how you are teaching them to advocate for yourself. So Denise, I'm going to bring you back in and ask you the same question. How are you advocating for yourself? I'm going to come back and ask you how you're advocating for mothers. But in your role during this pandemic, how are you advocating for yourself, especially during this week?
Well, I'm here in New York City. I'm in the epicenter of the pandemic, with the city being one of the highest ranking cities in the nation when it comes to deaths as well as COVID positive people here. We've had, a devastation here in New York. And to advocate for myself was really to set up boundaries in my practice as a doula, of what I would do and what I would not do. The first thing that I did spontaneously that many of you saw on the 5 o'clock news was to provide virtual support in the parking lot of a hospital. When the first wave of, support when it came to labor and birth was no support, no one can come and help this laboring person. So in doing that, I have made sure that my boundaries are maintaining with my profession, as well as to protect myself. So there's certain things that I'm not doing, and there's certain things that I am doing. I'm doing more personal care. I'm doing more of following the guidelines of self-quarantining, as well as providing for my family's additional resources that we could always talk about later on this call. But for me, myself, it was really to take a good introspective review of what it is that I need to do to maintain my practice as well as to maintain my well-being.
Thank you so much for that. I know that you, along with other service providers, you've had to shift in terms of keeping things moving, but encouraging your clients, potential clients, to get on board with technology in order to be able to provide services. So I thank you for that. So Nikita, can you tell us also about your role and how you're providing services? Well, first for yourself, how are you advocating for yourself with your practice here in New York as a mental health provider? And how are you advocating for yourself first? Thank you.
Thank you. So, for me, I've been really lucky, and I try to kind of lead my day with intention and gratefulness, right? I understand that I'm still able to work. Luckily, I'm by myself, so I don't have a family to worry about, which obviously is very different for other people. And so that makes my life much easier. I also understand my bandwidth, right? And so I set limits, not only with work, but with like social media. I minimize how much news I take in. And I just try to really spend some time with myself, intentionally, right? But for me, it's been really helpful just recognize that for me, this pandemic and everything that's been happening has been really inconvenient, and for others, it's been traumatic. And I think just understanding the difference of how I experience it has been helpful. I have been offering telehealth services for years. So luckily for me, it was an easy transition to get my patients on board because I work with pregnant women. Depending on how far they are along in their labor or whether they've had a loss or they have a newborn, they've always had an option of whether they can come in or have telehealth. I never wanted to have continuity of care stop because they couldn't physically come into the office. And so luckily for me, my patients are already used to this.
I think that's great for your practice that you already had that offering, as well as I think a lot of people that I've spoken to had to make that shift.
Yeah.
They were kind of hesitant with technology to get on board with that.
Yeah, I mean, it's not ideal. Most people prefer to come in person. Not only is it beneficial for the patient to kind of get away from their home and have something that just belongs to them. They like to come into therapy and this hour is just about them and not their families and their communities. Especially if they want to talk through things that are going on in their homes. You don't really get the same privacy. If you're in New York City, you know that the apartments are extremely small. And so it's very rare for most people to go on another side and not be heard, their conversations not be heard. But it is still better than not having therapy at all, right? And so with anxiety increasing the way it has and depression tripling and, we being traumatized over and over again right now, I mean, it's really been helpful to have this service for them.
Right. So, Ms. Heel, I'm going to also ask you the same question. I know you and I spoke briefly yesterday, but as a mom, I know you're not on the front line, but I wanted to know and share with everyone, how have you been able to advocate for yourself during this time? Not focused on your business, but you personally, how has it been for you?
I've been in my yard. I was in my yard from early this morning as a way of healing. After watching everything on CNN unfold last night across the US, bringing life, bearing witness to life in plants has helped me tremendously. I didn't realize how blessed I was in having a backyard and the ability to grow things until this pandemic. Spending time with my children. My oldest is 19 and he is on the front line. He is an EMT. We were in Florida on a mini vacay when this started. Flew home on the 6th. He worked as an EMT on the 7th, and on the 8th, he shipped out to the Atlanta area for a FEMA training where he was trained as a FEMA, person. I don't even know what his title is. Then he came back and his part-time job turned into a 60-hour-a-week job. And it's only by the grace of God that we haven't gotten sick. It's three of us three generations under one roof. My grandmother's 93 and we all chip in caring for her. My 14-year-old daughter has done remarkably well, transitioning from being in high school, her first year of high school, and doing the online work. So being mom to that teenager who's looking at, well, this has to be over by graduation. I need my what are those my braces tightened. I got to get my hair done. Mom, I want to get my nails done, and so on and so forth. To, well, wait a minute, I can change my wardrobe up for the summer now. Can we order this, that, or the other? To my 5-year-old who is like, well, why is everybody in the house and when are they going to leave so we can have our alone time? I'm actually enjoying my children. I'm thoroughly enjoying, there's a vast age difference. Enjoying spending time with them separately as well as together, because this is the time for us to be making memories as a family when the dust settles. Like my oldest is a full-time college student. Summer classes just started. You know, he's getting ready also to transfer from a 2-year institution to complete, his degree in biology while working mega full time, testing people going in and out of, facilities. So mental health for me, a lot of baths, a lot of hands and feet in dirt, a lot of laughter, some tears, unplugging when I need to, recognizing my limitations as a person, not just as, a mom or as a granddaughter, as a niece or a cousin, or even worrying about my parents who, my father's in DC, my mother's in Florida, and what's going on with them. Just having the wherewithal to come back into the present and meditate when necessary and just unplug and do whatever I have to do. I haven't left the house since returning on March 6th, except for the backyard, the front yard, or the driveway.
So I'm going to,
however, okay.
I'm going to shift and ask you, I'm going to shift and ask and start with you and go backwards now and say, with your nonprofit, and you're focusing on assisting and advocating for families who have experienced loss of children 2 and under. How have you been able to assist these families during this time? And what does the work look like for you?
Everything is done via Zoom or via phone. Uber Conference, freeconferencecall.com. The support groups that used to be in person are now online via call, and we invite anyone who suffered any type of loss this year to the calls. Grief and loss knows no age or boundaries, so anyone who needs any kind of support's there. Writing grants, because our community needs to eat, our communities need to live. So we want, I don't even know what this is popping up, I'm sorry. So just writing grants to be able to put food on people's tables. I order from BJ's in bulk, and just piecing off things for my elderly neighbors. We've been in this home since the 70s. So all of my neighbors watched me grow up and my kids, and whatever they need, I want to make sure they have it, because they would do the same for me if the situation was different. And also making sure that our communities, Black and Brown communities across the state, have what they need. And if someone in another state reaches out saying, look, I just don't know what to do, I don't have anything, that we can put together some sort of package to mail, to overnight to them, like ASAP.
Okay, so before I pass it on next to Denise, I want to just ask you, if those family needs or people do need, can they visit your website to get support from you? How can they do that?
They can visit my website and just send me an email, and no questions asked, no condemnation, whatever. We send out thinking of you cards to get people out of the moment. We send out whatever the need is at the time. Sometimes someone just needs to hear a voice outside of the people in their homes.
That is very true.
That's something,
So Denise, I'm going to,
send me an email.
Sorry. So Denise, I'm going to ask you the same question. I know that you have a lot to share in terms of how families can best advocate for themselves. Can she hear me? Denise?
I'm here.
Okay.
I'm here.
So can you share how mothers, those who are currently experienced with their pregnancy, how they can advocate for themselves, and what that looks like during this pandemic?
Well, it is a little trickier here in New York because the COVID information is changing all the time. I do recommend for families right now who are getting ready to have a baby, I strongly do recommend that they look into virtual doula support. And yes, have a doula, of course, but also look into virtual doula support, because the way this virus is working, from what we all know, because remember, we're all not properly informed about it. So if a family goes in to have a baby, they're relying on their support people to be able to come in with them. And if you should suddenly have a temperature, if you should suddenly not be able to pass the hospital's criteria, that mom could end up birthing by herself. So to have the virtual in place as a backup, that way she's getting the resources and the support and she's not alone. Families need to understand that every hospital is acting as a separate entity. The New York Tri-Borough hospitals are not acting in unison when it comes to their protocols for labor support. So families need to know and understand what the criteria is. And they also need to understand that many of these obstetricians and midwives, they are actually supporting now more inductions and more C-sections because of this pandemic. So as they get into the last stretch of the pregnancy, they need to ask very pertinent questions. What happens? Will you allow, you know, am I able to go past 40 weeks of my gestation? Am I able to have an induction, and or is a C-section a method of last resort? These are the type of things that families need to have clarity on, and that's where the fallacy falls in for our families of color, our Black families. There is a lack of clarity. There is a lack of clarity. And unfortunately, you know, I interviewed a lovely lady called Crystal. Her name is Crystal Brown. And she ended up testing positive with COVID-19 and had to give birth via C-section after a failed induction, and spent a week in the hospital and didn't hold her baby for the first 3 days. How do we empower that Black woman now to get the proper resources that she needs? To help her with her breastfeeding, to help her process this trauma, to help her household. Because when she tested positive, the whole, you know, her support system was asked to immediately leave the hospital with no instruction, no nothing. So this is what happened. You know, I went in and supported a birth 2 weeks ago. I was tested. And my results were never given to me by the hospital, but my results were shared with other people other than me. So we have to be careful of HIPAA violations. We have to be careful about what, you know, the stigmas are and what the governor executive order stated. I had to pay for my COVID test. I'm not supposed to. But these are the things that families really need to be in the know about.
I just want to back up and just, you know, don't want to assume that people that are watching are fully aware of what a doula is. And so while we have you on, can you just educate people of what a doula is and why it's a good advocacy for themselves, those that want to have children still, to consider having a doula? Like, what is the value of a doula? I don't know if you can tell me that in a few seconds.
Sure. A doula is taken after a Greek term way back in the day for someone who would come in and help during a pregnancy and birth. And a doula provides emotional, physical, and advocacy education support for families who are giving birth. And most doulas are certified, meaning that they've sat through extensive training and they've passed the certification process, and they went ahead and secured malpractice insurance for liability purposes and to encourage their profession to be professional. So that's what a doula does.
Thank you. And the last part with that, because there was misinformed information that New York had approved for Medicaid to cover doula services. And I was corrected. I see you nodding, shaking your head. I was corrected last year at a conference and said that the rate that the state was going to offer was extremely low, and I think doulas in New York had declined that. So I don't want to just throw out a number, like in terms of what's the range of what someone should pay if they wanted to say, I'm not going to take any risk, regardless if insurance will cover it or not. I'm going to explore a doula.
Well, the range goes from $0 to, you know, $3,000. You're paying on different levels. You're paying for level of experience. You're paying for the location. You're paying if it's a home birth as opposed to, you're paying on many different levels. But
Okay.
you want that person to have that experience. You want that person to have that certification, to have a lot of exposure and be entrenched in the community with the level of professionalism as well as activity that they have. So, a doula that's been very experienced, doing this for many years is going to have a higher fee because of that level of experience, as opposed to doulas just coming into the profession.
And the reason why I'm asking that as well is because we know that across this country, Black mothers, regardless of their income level, their education level, have lost life. And at this time with the pandemic, it's very helpful that Black mothers and their families have this extra support and they have options. And so I want whoever's watching this live or going to watch the replay to really look into and research more, to have those options and to have another person to advocate for them so that they feel that their voice are being heard, that their health is being highly regarded. And so I thank you so much, Denise, for the work that you're doing, and all the other doulas, wherever you may be, we thank you. And it's unfortunate that because of those high numbers of Black mothers who have died, that we do have to explore other options with giving birth so that we are around to see our babies grow up and to participate in their well-being, because again, I can't express the importance of having all of you available for our community to ensure that our voices are always heard and that our lives are taken seriously. So
I just want to add really quickly, if you
Yeah.
don't mind, just for your listeners, please understand that there's such versatility in birth support. You may not want that doula to come into the birth with you, but you can certainly have prenatal consultations. You can have birth preference, birth plan strategy. You can ask a doula questions. You can set them up for postpartum virtual support, breastfeeding support. There's so many different ways that you and your families can utilize doula support based on your budget, based on your circumstances. It is not a fixed thing. It is very unique as your family needs are. Doulas can accommodate that, and they work very hard to do that.
Thank you so much for adding that part. And that's, I appreciate you for saying that as well. Nikita, I wanted you to talk about your role in terms of assisting mothers.
Thank you.
In terms of mental health. I wanted to, one of the reasons why I was glad to invite you to this conversation is because your role is focused on maternal mental health. So, May is Mental Health Month, and it's also Maternal Health Month.
Yeah.
But I really wanted to invite you in because there are a large number of mental health professionals who are able to provide the services. But because PAM Project focused on Black maternal mental health, I wanted to give you an opportunity to talk about the work that you do, the services you provide, and how at this current moment, mothers and their families can get the professional support they need, because we're going through quite a bit.
Right. So I wanted to first say I love doulas. I recommend them to all of my patients. New York is very lucky, like she stated before, where there are services from every range. And so it's really important to have someone with you, whether COVID was happening or not, that can really advocate for you in those moments when you're distressed. And hospitals, it's a business, and people have to remember that, and they have their own agendas sometimes. And so with COVID happening, all of my patients, well, let me just take a step back. Everyone is layered right now. There's so much happening, whether you're going through infertility, whether you're currently pregnant, or you're going through postpartum, you're thinking about your family's health, your health, financial issues. How are you, if you're working, how are you managing work and your children? If losses, and not just people, loss of graduations, right? Loss of events that are really important that your family really values, all that is happening. And now you have COVID, you're worried about yourself, you're worried about your baby. I have patients as well who have been diagnosed positive, and depending on the hospital, I had some patients who were told, just wear a mask, your baby's negative, you can continue. And I've had the experience where the mother could not hold her child, what to do next. And then now you have, to talk about the elephant in the room, now you have all the riots happening, people are thinking about their children, their spouses, their cousins, their brothers, their uncles, all those things. And that really affects your body. Your mental health affects you, your physical body as well. And so it's really important, for me to talk to my patients about how to express how they're feeling to their doctors. One, holding space for them, letting them know that we're in this space where it's so much anxiety, so much depression, and it's not problematic, right? I think a lot of people come in and they're very afraid of diagnosis. They're like, am I suffering? Do I need medication? What's going on with me? Am I going to be able to go back to my status quo? And I kind of try to remind them that this is appropriate. The responses and how they're feeling is appropriate, and it doesn't require medication. You don't need this diagnosis in your life. It's very temporary, although it's very serious. And really to pay attention to their bodies, right? We hold a lot of our stress in our shoulders and our backs and, digestively, and so that can also affect your pregnancy, and so really paying attention to what's coming up and not ignoring it, because we don't know how we're holding our stress and we don't know how it's going to affect our bodies, And so I have opened up my practice to not only the mothers, but to the couples, because couples are struggling right now, right? If you had a partner that was working and is now not working, how they're handling stress impacts you as well. We don't all handle stress the same way. And so there seems to be a rift in a lot of relationships right now. And people don't have the tools and are not, we're not properly trained on how to communicate with each other lovingly sometimes, and in fairness, we're all, again, anxious, right? If you're anxious and you're feeling agitated and you're feeling a bit depressed, you're not the most patient person either, right? And so a lot of stuff is happening right now. So I've tried to do, outside of seeing my patients individually, I try to offer Zoom meetings too to people for their families, just to come out and say, this is how I'm feeling, and really being able to say to them, it's appropriate to feel this way. We all want to push past anxiety. We want to push past feeling angry. It's not a comfortable feeling, and that's problematic as well. So during this month, I really try to, I want to say that for our community, there has been an increase of, I don't want to say awareness. We've always been aware of mental health, but there's an increase of wanting to accept mental health, right? Accept that we need to look at it and look at it the same way we look at our medical health. People are starting to learn the difference between mental health and mental illness. They're not the same. I tell people the same way you go for a checkup for your body, mental health is checking up on your mental health. It doesn't mean you have a diagnosis, right? And I think because people are more open, and because of COVID and everyone feeling this kind of pain, people are more comfortable and coming and saying, I need help, because they feel like collectively everyone needs help. And so it doesn't seem so individualized anymore. And so
do you feel that there's been an increase of people seeking professional help at this time?
Absolutely. I think so, because it's common right now. If you watch the news, if you watch, social media, in TV shows, it's now become a part of regular conversations of people saying, oh, I went to my therapist and this is what my therapist said. And so it's not as taboo as it used to be. Of course, that depends on the generation you're talking about, but for the most part, people are now open to receiving help. I've had patients that come in and say, I'm coming to therapy. I don't really have a problem. What should I be working on? And I'm like, okay, well, what do you want to talk about? And very recently, I want to say, especially with all the riots and everything that's happening, people have just come in to say, look, I'm just angry and I need to talk to someone about it, without having someone, try to fix my feelings right away,
Right.
And so I think there's a huge increase. I know right now a lot of Black mental health professionals are now accepting insurance in a way that they weren't. The panels have opened up. And what I mean by that is, Medicare, Blue Cross Blue Shield, they were closed for a little while, which is why it was very difficult to find a person of color to provide service. But because of everything that's happening, all the panels opened up and allowed us to be able to accept these insurances, right?
I want to speak. Yeah, I want to speak to that. I'm glad you brought that up because at one point, for 2 years, I was doing a lot of interviews and just collecting stories of Black mothers from every part of their journey. And they would private message me and say, I'm looking for a therapist. And in some cases, I would try to vet people. And maybe they might do sliding scale. They wouldn't always take all the insurances. I know that we've had some improvements in terms of databases that provide services. You can look up and find a therapist. A lot of times when people reach out to the PAM Project, I would go to Psychology Today because it has a great filter.
Yes.
You can put in your zip code, you can put in your insurance, and you can get a whole list of good options. But it's nice to hear you say that mental health professionals of color are opening up and giving people more options because we
Yeah.
really need it. I think that's great.
I mean, just today I saw about 4 different Zoom panels for Black men alone to kind of discuss what's happening, right? People are putting themselves out there and saying, I'm going to open the space for you for us to have these discussions in a way that we've never had them before. And people are taking advantage of them, you know,
Yeah.
because we need it. I mean, the trauma, even the trauma that we do to ourselves, I even encourage my patients to step away, limit the news. We don't need to see the videos. We know what's happening. We don't need to, I call it trauma porn, right? We don't need to constantly, re-traumatize ourselves. That is not for us, right? That message is for the people who don't know it, what's happening, which is another conversation. But, really being mindful of what we have coming in. I saw a video yesterday of a dad walking out his home and his 3-year-old child said, Daddy, are you going outside? Or are you going to get shot? And that kind of stuff is heartbreaking, right? And it just goes to show how this child is probably just hearing the news, right? And that there's no conversation being had with him. And we don't even know how from so little we're getting this messaging over and over again and what it does to us and how it affects us and how it affects the way we eat. And we were talking about comorbidities and all those things. They're all connected, right? And so it's such a strange time that we're able, well, not a strange time, it's a good time to connect the dots for a lot of my patients about what they see happening in the news with racial disparities and how it connects to the hospitals and that setting and how medically we're not treated well and that all of this kind of goes together, right? And they're not crazy, right? When they have these feelings and they feel like they're unheard and things like that.
I want to just follow up with something you just said earlier. So like 2 hours before this talk, I'm in Manhattan as well. I had to go to the East River and sit. I had to really, I woke up to so many images of our communities across the country, and it was overwhelming.
Yeah.
I felt like I was revisiting 2016, 2017, where it was so like Black man killed after Black man killed, and it was just like, what year are we in?
And just really quickly, how many of my patients have to speak to going on to now Zoom meetings with their coworkers, working in predominantly white spaces and hearing silence from them and not being able to really having to put on a face and put on a mask and do all the things that they're expected to do while they're hurting inside. I mean, I just don't think people realize how nuanced it is and how much layers of hurt that we're going through right now, right?
Yeah. So ladies, I'm going to ask the rest of you to chime in on what she just said because we have a few minutes and I definitely want to hear from all of you about how you feel about how others are responding or not responding to this time and how it impacts their mental health. So Denise, I'm going to start with you and then I'm going to ask the other 2 ladies to chime in.
Rephrase the question again.
So I wanted to get how you feel about how the public is dealing with our pain, basically.
How do I feel about it? There's still work to be done. This is as has been said on this call. This is a layered thing. White people are not woke right now because they're witnessing our trauma. They're not woke. This is a layered thing. I don't want all of this effort and all of this action to disappear into the ether as has had happened in the past. And right now, it really is up to our young people who stepped up. It's time for white people to step up, and it's time for us to take better care of ourselves. And we have to think about how this is going to impact our children. What is going to be the cognition level of our children when they see their parents going outside? What is the cognition level going to be generations later after babies have to keep looking at their mommies and daddies like this? How is that going to impact this generation in the future? And those are the things that we have to look at, and we have to do something to preserve and to be aware of that. But our awareness is on levels. This is not just a quick fix situation. This is going to take some serious level work.
Okay. I still can't hear you.
I can't hear you, Pam. I mean, Alicia. I can't hear you.
Yeah, I'm so sorry.
Okay.
What are your thoughts?
I'm
still on the front line of how the public is responding.
So much has been said. I want to just narrow down to two things. One is I just want to touch on the impact everything has on my relationship with my own children. So my son, my 20-year-old who lives here, is going out today, and so I was asked, where are you going? And giving him all the information about, okay, there's likely to be protests out there today. Which freeways are you taking? All these things, like, I feel like I'm grilling him. And, at 20 years old, they don't want to have to talk to you anyway. But it's for his safety. So a normal conversation of, oh, well, what time will you be home turns into, well, where are you going? What freeways are you taking? Well, this happened in Oakland last night. You're not going to Oakland, are you? So all of that happens. And then just being on pins and needles normally when he leaves the house. So I just wanted to name that. As far as work is concerned, Tuesday I was sick. I had some stomach issues. I didn't go to work. I called in sick. Wednesday, I go to work and I thought to myself, I should have called in sick because I am mentally and emotionally sick today. I work in a jail. I work with law enforcement. I work with deputies, and I go to work. And thankfully I have my own office with a door that I stayed in the majority of the day because I didn't want to hear the conversation. Because all it's going to take is for some person to say the wrong thing, and then I'm going to be triggered, and then I'm going to have to bridle my tongue and my attitude and my facial expressions. And for the sister who said, we got to show up to meetings. We have to participate. And people are at work on Wednesday like everything is everything. And I just want to scream, they're killing us. And that part is difficult. It's difficult to manage. It's very difficult to manage. And we're doing the best that we can. I've been spending a lot of time talking. I've been writing. It helps, I always joke, writing is cheaper than therapy. But one of the things I also want to name too, because my bonus daughter mentioned it in the comments about the lack of mental health care for Black mental health in the Bay Area. That when we, in a short period of time, in less than 5 years, my family experienced tremendous tragedy, including the loss of 2 of our sons' lives. And in trying to get therapy for myself and my children, it wasn't available. It wasn't, and when I say it wasn't available, you got the issues with insurance, and so the people, the therapists who were available through our insurance didn't look like us and had zero understanding of what it is like and I can go into a whole tangent about when we talk about medical care. And when my oldest son was in the hospital, he got shot on a Friday night. He has 17 gunshot wounds. And on Tuesday, they're talking about releasing him. And so this is layered and layers and layers of what we deal with as Black moms, and then when you have the wherewithal and the fortitude to know that your children need therapy, then you can't find culturally competent, capable therapists. And then what do you do? And even for myself. And it's been difficult. And so we need to, as we are becoming more aware and open to therapy, because the other thing I want to name is historically as a people, we didn't do therapy. But now that we're becoming...
Can I interrupt you really quick? I just want to say that right now, because of everything that's happening with the pandemic, the ABA has lifted different policies, so you're able to see other therapists outside the state, which we couldn't do before. So as a person who's licensed in New York, I was only able to see patients in New York. Because of everything that's happening, they lifted that. And because it's virtual, if you need to find a therapist or anyone in your family or anyone for that matter, they can now see therapists outside of their state. And so if you want to find a Black therapist, it's important for people to know they can look outside of their state now to other places who may have the specialty that you need and really take advantage of the time that all of those restrictions have been lifted.
Oh, okay. My daughter is asking that we post your information. I don't know that you're taking patients.
I'm taking patients. I see patients. I even have a patient right now in Liberia. I have patients everywhere. So yeah, but I really encourage people to take advantage of that. Because what's going to happen, even if that changes and if they put the policy back in place, they won't stop continuity of care. So if you already are a patient of someone in another state, they won't then say you can't see that person anymore. So you won't even lose that person.
Okay, so I have my daughters and my bonus daughter on our comments. I don't know if you all can see the comments where they're asking for the information. One last thing I want to say.
So what I'm going to do is her information is available, but I am going to share this out, and I do belong to a couple of mental health, professional mental health groups, and I'm going to encourage them to go hard and share the information now that is available for, regardless of where they are, they can provide services, because we have to be each other's keepers. We have to recreate what our villages look like. And so this conversation is so necessary, because our communities need to know about resources that are available to them so they have options, right? And so that we know how to best advocate for ourselves. I encourage whoever's watching now or on the replay to push for what you need. I know that a lot of doctors right now are also afraid for their lives, and that a lot of people are pushed for virtual appointments when they can actually still see them. If they don't have signs and symptoms, you need to push and say, no, I need to see you. And not waiting for June, July, or August or September for an appointment. Say, I need to see you now, because it's urgent. And don't just assume because they're a doctor and say, well, my doctor said I can't see them now. No, it's your health, and you need to advocate for yourself in that capacity. I won't go into details, but personally myself, I had to push and to get what I needed. And it's a new day that our lives are being lost, and I strongly believe that several people who have passed away did so because they listened to their doctors, and they didn't challenge their medical professionals and saying, no, I need this, or I need a referral, or this is not good enough, I need other options. We have to really be fighting for our lives when we advocate for ourselves. So, Ms. Hall, you didn't get a chance to say also what you're doing also. I know you did mention earlier that you're providing workshops and trainings for families, but if you wanted to just add something else in terms of how you are helping your community with loss, so people are able to be aware, not to be afraid and keep it silent if they experience loss, and that they should seek out professionals like yourself. Can you just speak briefly about that? I know I'm wrapping up the last 2 minutes.
Just being able to be present with your pain if you're experiencing any type of pain due to the loss of an infant or the loss of your mother or the loss of your spouse or any loss in general, the loss of your job. We're grieving so many things in our communities these days. Being present and also understanding your own body and not allowing the medical providers to tell you what your pain level is or that you're not supposed to feel pain. You're the best advocate for you, whether it's for your mental health or for your physical health. You're the first stop. And just know that if one doctor says no, we have the blessing of being able to seek out other doctors, other medical providers in different fields. And one will say yes. You just have to keep going and keep self-advocating.
I think that, thank you so much for that last remark. And it's so important that we know that. I had recently, again, I said this is because I had an experience where I pushed back and a patient advocate said, well, he's a really smart doctor. I said, yes, he could be a really good doctor. He could be a really smart doctor, but this is my body. And I need what I need. And I'm not going to be comfortable until I get the resources and the support that I need. And this is really a crazy time because doctors are not taking new patients, right? And so, and even if, unless it's a referral, and so you could be stuck with someone that you need to teach and say, I'm important and you need to take me seriously. And if it requires that you be physically examined, that you do that, especially if you don't have any signs and symptoms of the virus. It's so important that we know to do that, because a lot of times we just believe because they have the credentials that they know best. And no, and that's not the case. So it's now been an hour. And this conversation needed to be longer. I think I could do one-on-one with each of you because the work that you all are doing is essential to our community. And with my role as being the advocate and the founder of the PAM Project, I advocate for Black mothers from pregnancy to empty nester. And all of you play an important role in those mothers in different phases of their lives. And so I really thank you. I hope that we today, on this last hour, were able to plant some seeds and give people some good food for thought. And I hope that they will reach out to you individually, depending on where they are in their motherhood journey. That those who are not mothers, that they share this video with mothers so that they can look deeper into what is a doula? How can we hire a doula? Can we fundraise for doula? Whatever we need to do to get a doula. If collectively we need to have a Zoom for the family for mental health counseling. I don't even know if that's possible, but whatever we need to do. And also for our families and our individuals who are incarcerated, let's not forget them during this time. If you can send them a package, if you can send them a card, reach out to them. Do not let them feel that during this pandemic that they are by themselves. We have a sister that's working in California hard on the grind, but there are several Black women and men like her doing the advocacy work for those that are incarcerated and offer their families to give them the emotional and mental support to help them, because it's difficult to make sure that their voices are not heard when they're not seen. So again, I close out in saying thank you, ladies. Please be prayed up. Please do whatever you need to maintain your own mental health and well-being, because you are necessary for our communities, and we love you and we need you and we appreciate you. God bless, and stay off social media for the rest of the day if you can. God bless you.
Take care.
Thank
Bye-bye.
you.
Thank you.
Thank you.
Thank you. And to those that are still watching, I just want to thank you so much for the support of the PAM Project. And I hope that you will continue to advocate for Black mothers. to check in on a Black mother, to make sure that she is well. Sometimes we carry so much on our shoulders and we do not stop and pause and ask for help. And if that is the case, do not wait for her to ask for help. Take the time to say, how are you doing? Engage with her and let her know that you are a part of her village. That is how we let Black mothers know they are not alone and they have you as part of their village. Thank you so much and God bless.